Worthington Square is a 10-bed psychiatric unit
targeted for the geriatric population, so people 55 and older. This is the first designated PART unit in the state of Illinois, so we were the first critical access hospital to open a unit of this sort in the state.
The administration here at Illini Hospital did a market survey to find out what the needs for the community are.
Worthington was an outgrowth of the Community Health Needs Assessment. That's an assessment that's done every 3 years.
They were able to take that needs assessment and identify that mental health was a need in our community.
So we have child, adolescent, adult in our area, but we do have a gap for those people who are 55 and older. The number of people who are reaching that Medicare age is growing exponentially.
We do have an older population, and so we do try to meet the needs of those patients.
We estimate that by 2030, at least 25 to 30% of the population in rural America will be above that age of 55. So we found that that is a big need area just by demographics. Secondly, about 20% of people over the age of 60 have some sort of behavioral health issue. So we know that it is a definite need, and we felt that this was a good market for us to enter in and a good service for us to bring to this community.
If Worthington Square wasn't here for our community to meet the mental health needs of our residents, they would have to travel great distances from Pike County.
Adult geriatric patients from here would go either to Alton area or to the Galesburg area. So our hope was to be able to get people not only from the Pike County, the Adams County market, but even into the Missouri side of the market and in southern Illinois.
With our population, we serve a pretty large area here, and people come from a long way around to reach our services.
Referrals can come from any source. It can come from a physician, it can come from an ER, it can come from a nursing home, depending on where that patient enters the healthcare arena. The intake process is really pretty simple. They call Illini, they ask for the folks for intake in Worthington Square, and that's pretty much it.
Worthington Square, being a receptionist.
When a patient arrives at Worthington Square, we complete an assessment that really allows us to develop a treatment plan.
We have a pretty accurate understanding of why they've come into the hospital with our what's called a biopsychosocial. And from that document, we're able, with our other practitioners or nurses, to create a multidisciplinary treatment team approach.
No two patients are the same, and so no two patients' treatment is going to be exactly the same.
The first thing, the most important thing in caring for a patient is safety.
There is so much forward thinking that went into the design of this unit.
Everything in it has the safety of the patient